Chair recognizes Mr. Stanley of Waltham.
Thank you, Mr. Speaker. Mr. Speaker, through you and to the members, today it is my privilege as House Chair of the Elder Affairs Committee to rise and speak in favor and support in House 4178, an act to improve quality and oversight of long-term care. This bill represents a momentous step forward in improving quality of care and access to services in the Commonwealth's long-term care facilities. The additional support for direct care workers in this legislation will address the long-term care workforce crisis. Bad actors, nursing home operators who neglect the safety of their employees and residents will be held accountable through improved and extended suitability standards and strengthened oversight reviews. Before getting into the particulars of House 4178, I'd like to take a moment to acknowledge all those who made contributions to this omnibus legislation. Mr. Speaker, I would like to thank you and your team for prioritizing long-term care in the House and supporting the efforts of the Elder Affairs Committee to develop this legislation. I also appreciate the assistance of the Chair of House Ways and Means, and the gentleman from North End, and the Chair of Healthcare Finance Committee, the gentleman from Watertown, and their staffs, as well as House Counsel in preparing House 4178. I also want to recognize the House Vice Chair of the Elder Affairs Committee, the gentle lady from Melrose, who jointly presented this bill with me in the House and was a true partner in crafting this important legislation. This legislation would not have been possible without the extraordinary efforts of the Elder Affairs Committee staff, my staff director, Mark Phillips, the tall one, and Joe Russo, the research director of the Elder Affairs Committee, as well as Juliana Fernandez, research analyst. They put so much time and effort into the thoughtful and robust long-term care reform bill before us today. I also want to thank the recent chairs of the Elder Affairs Committee as this legislation builds off their work in previous sessions. The gentleman from West Boylston, the gentle lady from Marlborough, the gentle lady from Needham, and most recently, my friend, the gentle lady from Newton, who represented the House on the 2020 Nursing Home Task Force. As we all know, nursing homes provide essential services in care to older adults, those recovering from illness or operation, and individuals with disabilities. These facilities are often the last resort for individuals in need of long-term services and supports. For those with complex needs requiring round-the-clock help, such as individuals with advanced stages of Alzheimer's disease and other dementia, staying home may no longer be an option. Recent data shows almost 50% of long-term care settings have Alzheimer's or dementia care patients. As such, nursing homes must remain a critical part of the continuum of care for some of our most vulnerable residents. Nursing homes became the epicenter of the COVID pandemic, accounting for nearly 60% of deaths in the state during its height. Issues such as infection control were given greater scrutiny. But the truth is, the long-term care industry was in crisis well before the pandemic. Staffing shortages, bad actors, abrupt closures, patient abuse, and diminished care all existed prior to March 2020 and have created serious hardships for thousands of individuals and families across the Commonwealth in need of quality care. I know firsthand of these struggles. My father, a former member of this body, passed away several years ago and spent a lot of time in and out of nursing homes in his later years. I observed many levels of care, some excellent, while others in need of improvement. During my father's last days, he took a fall. I had to cushion his head in my lap while my wife ran up and down the hallways looking for help. That memory of the memory of that day has remained with me, and one I have gone back to again and again throughout the process of developing this legislation. My interest in solving challenges in long-term care also stems from the rising number of calls received from constituents on behalf of loved ones in need of care at nursing homes. Some are being told that despite available beds, there is not enough staff to provide care for them. Many have been waiting in hospitals for weeks, even months, to be discharged into a long-term care facility when available. Others have called because they suspect theft, verbal and physical abuse, and some rape. Still others are desperate to find a bed nearby after an abrupt closure. I know most of you can relate to this and have received these types of calls as well. The bill before us today includes many transformative policies addressing 4 key areas of reform in long-term care: workforce development, accountability, transparency, and oversight in long-term care facility operators, enhancing quality of care to residents, and improving access to long-term care. First, this legislation recognizes that professional development and training are critical to recruit, develop, and retain direct care workers who are committed to serving our most vulnerable residents. The bill establishes the Long-Term Care Workforce and Capital Fund that will support several programs: training for prospective care providers to become certified nursing assistants, which would incentivize more to work in the long-term care facilities; career ladder training for CNAs to become licensed practical nurses, which would remove some of the largest barriers to professional growth in the industry, including tuition costs, paid time off to attend school, childcare, and transportation expenses; leadership training for nurse leaders, which will build their supervisory skills and help them become more responsive and inclusive managers. The bill also encourages coordination between DPH and nursing homes on best practices and education on current standards. And very importantly, we also require the base year for Medicaid rates to be updated every 2 years, and for the first base year to be no more than 2 years away from the current rate year. This will help stabilize reimbursements to nursing homes and allows for costs such as increased wages to be regularly accounted for in the budget process. Second, this bill demonstrates the Commonwealth's recognition of how important strong policies ensuring accountability, transparency, and oversight are to eliminating the few bad actors and preventing them from undermining and weakening the long-term care industry. While most owners and operators of the Commonwealth's 300-plus long-term care facilities While most owners and operators of the Commonwealth's long-term care facilities are doing their best to provide high-quality care to their residents and support their staffs, several bad actors have cast a shadow over the industry. One company, which operated 10 facilities in Massachusetts, lined their pockets with millions meant for resident care and workforce supports, which led medication errors, inadequate staff training, and lax infection control. Another company, which owned 5 nursing homes, received over a dozen citations for failing to make timely payments to employees, resulting in staff shortages and endangering the health and safety of residents. There are many other examples as well. Thanks to the oversight from the Department of Public Health and Attorney General investigations, these owners and operators were held accountable for these egregious offenses. Yet we must do more to prevent bad actors from putting residents in harm's way to begin with. This legislation provides DPH with additional tools to monitor and take punitive action against facilities, including new abilities to limit, restrict, suspend, or revoke a license for cause, and appoint temporary managers to help avoid bad outcomes and turn facilities around before it's too late. We also strengthened DPH's licensure suitability standards to include a more comprehensive review of the background and legal record of applicants and expand the scope of review to include any entity with at least 5% ownership interest in a facility. This legislation also increases accountability for underperforming long-term care facilities by raising civil penalties sought by the Attorney General in instances of abuse and raises the statute of limitation from 2 years to 4 years to give their Medicaid fraud unit more time to act against bad actors. We also direct DPH to examine cost trends and financial performance across the long-term care industry that will help regulators and policymakers untangle the complicated ownership structures of nursing homes. Quality of care. This legislation recognizes that improving service delivery and quality of care standards in all long-term care facilities must be a top priority and takes several clear actions to affirm our commitment to the cause. We require facilities to develop outbreak response plans and DPH to monitor and approve plans that will help prevent the spread of future infectious diseases in nursing homes. We direct DPH to create a clear process for small house nursing homes to be licensed in the Commonwealth. With less individuals per unit and higher levels of resident satisfaction and quality of care, small house nursing homes are emerging as an alternative to the traditional long-term care facilities. Yet the current regulatory process is very burdensome for potential facilities. We also require DPH to establish new regulations aimed at reducing social isolation in nursing homes, especially among those in memory care programs who are deaf and/or blind or have developmental disabilities. Addressing social isolation could slow disease decline for residents with dementia and will reduce stress on the dedicated staff caring for these individuals. The Long-Term Care Workforce and Capital Fund would also be used to support a no-interest, forgivable loan program for eligible nursing facilities to help them develop specialized care units and update emergent energy systems. Loans could also be used for projects that convert a portion of a facility to an alternative service, such as affordable housing or an assisted living unit. Last session's ARPA bill included similar language plus funding that saw significant interest from the industry. Access to care. Lastly, this legislation includes additional policies to address the throughput challenges of patients in hospitals awaiting discharge to a nursing home. We require the Division of Insurance to develop and implement uniform prior authorization forms for admissions from acute care hospitals to long-term care facilities. We also launch a pilot program that would streamline prior authorizations from admissions from hospitals to nursing homes, so patients are waiting in hospitals longer than they must when a nursing home bed is available to them. We established a task force to further study and propose recommendations on the impact of persistent delays in discharging patients to nursing homes. We allow patients who are incapacitated or otherwise in need of someone to act on their behalf to cover more of the costs associated with guardianship fees. In total, the Act to Improve Quality and Oversight of Long-Term Care is the culmination of an enormous investment in time, hard work, and cooperation by so many. It offers us the chance to take a giant step toward resolving many of the serious problems that prevent our long-term care facilities from providing the best possible services and care for our disabled and older residents. They and their families are counting on all of us to act for them now. There is no time to delay. I ask for your consideration and for your support for this measure, and that when a vote is taken, it is taken by the call of the yeas and nays. Thank you.
Stanley asks when the matter is taken to be taken by a call of the yeas and nays.